Medical conditions that may restrict air travel. Air travel has become an integral part of our globalized world, connecting people across vast distances. However, for individuals with certain medical conditions, flying may present unique challenges and considerations. Airlines prioritize passenger safety and must be aware of potential health risks during flights. In this video, we will explore some medical conditions that could restrict or require special attention before boarding an aircraft, and how to navigate air travel restrictions. For simplicity, the 18 medical conditions will be explained under the following conditions. 1. Cardiovascular conditions. One of the primary concerns for air travel is the impact on the cardiovascular system. Conditions such as recent heart attacks, unstable angina, or severe heart failure can make flying risky due to the reduced oxygen levels, changes in cabin pressure, and prolonged periods of sitting. It is crucial for individuals with cardiovascular conditions to consult their healthcare provider before planning air travel to assess their fitness for flying and ensure appropriate precautions are taken. 2. Respiratory conditions. Certain respiratory conditions, particularly those affecting the lungs, can pose challenges during air travel. Conditions like severe chronic obstructive pulmonary disease, pulmonary embolism, or recent pneumothorax may be exacerbated by changes in cabin pressure, low humidity, and decreased oxygen levels. Travelers with such conditions should consult their healthcare provider and consider obtaining supplementary oxygen if necessary, in accordance with the airline's policies. 3. Neurological conditions. Certain neurological conditions can complicate air travel due to their impact on mobility, consciousness, or increased susceptibility to seizures. Conditions such as uncontrolled epilepsy, recent stroke, or severe Parkinson's disease may require specific arrangements or medical clearance from a healthcare professional. Individuals with neurological conditions should communicate with their healthcare provider and the airline well in advance to ensure a safe and comfortable journey. 4. Pregnancy. Pregnant women often wonder about the safety of air travel. In general, flying during a healthy, uncomplicated pregnancy is considered safe up until the 36th week for domestic flights and the 32nd week for international flights. However, each airline has its own regulations regarding travel during pregnancy, so it is crucial to check with the specific carrier before making any plans. Additionally, pregnant women should stay well hydrated, move around periodically, and wear compression stockings to reduce the risk of blood clots during long flights. 5. Infectious diseases. In the context of infectious diseases, public health concerns and the potential risk of spreading infections have gained prominence. Airlines and public health authorities may impose restrictions on passengers with contagious conditions, especially during outbreaks or pandemics. Individuals with highly infectious diseases, such as active tuberculosis, severe respiratory infections like severe acute respiratory distress syndrome (SARS) may be denied boarding or required to follow specific protocols to minimize the risk to others. 6. Mental health conditions. Mental health conditions, such as severe anxiety disorders, panic attacks, or conditions that require continuous medical supervision, may require special arrangements and medical clearance for air travel. The unfamiliar environment, confined space, and potential stressors associated with flying can exacerbate symptoms, making it necessary to consult with mental health professionals before planning a trip. It is important to note that these are just a few examples of medical conditions that may restrict air travel. Each airline may have its own specific policies and guidelines regarding passenger health and safety. It is advisable to contact the airline directly to inquire about their requirements and any necessary documentation or medical clearances needed before booking a flight. The key takeaway is that passenger safety and well-being are paramount for airlines. By being aware of these medical conditions and seeking appropriate medical advice, individuals can ensure a smooth and hassle-free travel experience while mitigating potential risks to their health. Remember, when in doubt, always consult your healthcare provider or specialist before embarking on air travel, especially if you have an existing medical condition. How to navigate air travel restrictions. If you have a medical condition that may restrict air travel, there are several steps you can take to ensure a smooth journey. 1. Consult your healthcare provider. Before planning any air travel, consult your healthcare provider to assess the potential risks and obtain necessary medical clearance. 2. Notify the airline. Inform the airline about your medical condition when booking your ticket. They can provide guidance on any necessary documentation or special arrangements that may be required. 3. Carry relevant documentation. Carry copies of your medical records, doctor's notes, and any required clearances or certifications to present to airline staff if needed. 4. Plan ahead. Consider factors such as the duration of the flight, availability of medical assistance on board, and potential layovers when planning your trip. 5. Medications and medical supplies. Ensure you have an adequate supply of necessary medications and medical supplies in your carry-on baggage. Keep them properly labeled and easily accessible. Remember, the primary concern for airlines is the safety and well-being of all passengers. By proactively addressing any medical conditions and following the appropriate procedures, you can help ensure a smooth and safe journey. Please subscribe to our channel so that you can be notified when we release the next video. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.